let me welcome Prof. Bob, who is our major presenter today on the peer reviewing process. And just a way of mention, Professor Bob Marsh is the Editor-in-Chief for the African Journal of Primary Healthcare and Family Medicine. So he oversees the overall editorial process of the as far as the journal is concerned. And this journal is owned by the Primary Care and Family Medicine Network, but also is the official journal of the World Organization of Family Doctors in the African region, Wonka, Africa. So, Prof. Bob, we have quite a significant number of attendees, so which shows that there is really a lot of interest as far as peer review is concerned. So, you are welcome to make your presentation. So, you have 30 minutes. Thank you.
Great. Thank you very much, Innocent. And yeah, welcome to everybody. It's really a great delight to see so many people attending the webinar on peer reviewing. Just going to share. This is my slides. Yeah, as Innocent said, this is on behalf of the African Journal of Primary Healthcare and Family Medicine and the publisher AOSIS. They also got a couple of people here that are going to speak in the second half of the webinar on some of the more sort of practical and technical aspects of peer reviewing in the journal. And I'm going to cover more of maybe some of the sort of academic or conceptual aspects. But we're going to start with a quick poll to see who's in the room. And Neil, can you activate the poll?
I just did so. Please let me know if you can see it.
Yep.
Okay. Thank you. Answers are coming in already. I'll leave it open for a moment.
I have submitted my response. Thank you.
Thank you very much. I see the response rate is great. To 70 responses already. Just give it another moment or so. Close the poll in 10 seconds. Share results. Can you see the results coming up?
Yeah, well, I can see them. Hopefully everybody can. So I see, yeah, so in the room, actually 42%, about 35 of us have previously peer reviewed for the journal, but actually more, the majority of people in the room have never peer reviewed for the journal. So hopefully this will inspire you to join us and help with the peer review process. And then of those here, I see about half see themselves as sort of emerging peer reviewers. Maybe you're a bit modest, but you're kind of not a novice, but you're not yet feeling like a very experienced peer reviewer. So we've got about a quarter who are novices, new at the game, and a quarter who are feeling that they're quite experienced. So okay, that's great. So it makes this webinar very worthwhile. Okay, thanks, Neil. So there we go. So this is what I'm going to talk about. A little introduction, a little bit of background to the journal, then going through the peer review process in some detail. A little bit of thinking about strategies to improve peer review, and then we'll have the questions and discussion from you. Starting with this quote from Richard Smith. He was the former editor of the British Medical Journal, and he wrote this book called The Trouble with Medical Journals. So he says, peer review is at the heart of the processes of not just medical journals, but of all science. It is the method by which grants are allocated, papers published, academics promoted, and Nobel Prizes won. Yet it is hard to define. It has until recently been unstudied, and its defects are easier to identify than its attributes. Yet it shows no sign of going away. Famously, it is compared with democracy, a system full of problems, but the least worst that we have. So I think, yeah, it's actually quite a good starting point to think about peer review as the least worst process we have for deciding on whether to publish research or not. This is the background to the journal. So we were launched in 2008. As Innocent mentioned, the initiative largely came from the Primary Care and Family Medicine Network in Sub-Saharan Africa. So we've been going, what is that now? 15 plus years. So the scope of the journal is that we are very much publishing material that's either from Africa or about Africa. So we're unfortunately not publishing material from outside of the African continent. And of course, it has to be from primary healthcare or family medicine as a context, or at the very least, clearly about primary healthcare and family medicine. We do get quite a lot of submissions, from tertiary hospitals, and most of those, do not fall into the scope of the journal. So we're really wanting material from family medicine, from primary care, from district health services, from or about Africa. We do then have some special collections or sort of subsections to the journal. We have one on pain and palliative care, so particularly interested in that as a topic. A recent addition has been the maternal and neonatal health subsection, which the midwives in the region are championing. We have another subsection on sexual health, and a new, I wouldn't say so much of a subsection, but a new series on therapeutic letters, which we're hoping to link to the International Society of Drug Bulletins, looking at therapeutics, and then a number of periodic sort of ad hoc special collections. We've just finished one now on looking at advocacy for family medicine in the region, but we've had many previous ones. We're currently collecting material on a collection on primary care research methods as well. And as Innocent mentioned, we are officially linked to WONCA, the World Organization of Family Doctors, and the Prima Famid Network. So we published, actually mainly publish original research and sort of formal reviews, but we also have editorials, short reports, which we see as sort of somebody sharing maybe an innovation with some sort of soft evidence and reflections on it, opinion papers based also usually on the evidence, but more obviously of a narrative opinion on a particular topic, conference reports, country profiles, scientific letters, which are really sort of mini original research articles where there maybe isn't enough substance for a full article, and occasionally patient studies as well. So it's the sort of range of materials that we publish. This is my team. Innocent you've met, so he's the assistant editor for East Africa. We also have Zara Milan covering Southern Africa, Musa Dankiao, West Africa, Fina Lubaki, Central and also French-speaking Africa. So we do accept articles in French or from French-speaking Africa, and Fina looks after them. Doreen Cowra looks after our maternal and neonatal health section, Renee Krauser, the palliative care, Sean Chetty, the pain, Deirdre Pretoria, sexual health, and then Michael Pather and Roland van Rensburg, the therapeutic letters. So that's my team, or the team that you would encounter as well if you were submitting or peer reviewing. So just a little bit on some of the statistics. So before it goes to peer review, the editor-in-chief, which is me, we screen the submissions, and currently we have a 56% pre-review rejection rate, which means that it doesn't fall into the scope, usually doesn't fall into the scope of the journal, or there may be other issues which I'll mention later. Then it goes for review, and currently our post-review rejection rate is 37%. So the overall rejection rate is 72. So it means if you submit to the journal, you currently have, a 28% chance of being published. I was actually not bad compared with a number of journals where the overall rejection rate would probably be a lot higher. How long does it take to get through all of this? You can see from some of the statistics that we're actually doing a little bit better at the moment than we were a few years ago. But the time to the first decision by the editor in charge of the submission is 50 days at the moment, so just under 2 months to complete the peer review process. The time to acceptance, so often after that first decision, there's an ongoing process of revisions and sometimes also further peer review. That takes us 110 days at present on average. Once it's been accepted, the time in production is on average 71 days until it appears actually on the journal website. So these are not too bad, I think, by comparison to other journals. Certainly, I've had a lot worse experiences with some of the other journals that are around at the moment. Where do our authors come from? So you can see that we're rather dominated by South Africa. During this period, 785 were coming from South Africa. The next largest contribution was from Nigeria, and then, as you can see in the list, followed by Ghana and Kenya, the UK and Malawi, and so on. So we do have, I would say, as a journal, a sort of developmental philosophy. You know, we're very keen to support novice researchers, early career researchers in getting their work published, and particularly from countries that are not South Africa, but in the region. And so we do bend over sort of backwards a little bit to try and bring submissions up to a publishable state, particularly if you come from countries which haven't published very much in the past. So that's where our authors are coming from. Okay. So now we're going to talk a little bit about the peer review process in general, but also with specific reference to this journal. So this is, in essence, the process, just to go through it. So obviously somebody submits a paper to the journal. There's some technical checks, but once everything is complete, I am asked to look at this and make a decision as to whether it fits into the journal's aims and the scope of the journal, and whether it's worth sending for peer review. Then it's assigned to one of the editors on my team, who then select reviewers, the peer reviewers, usually 2, sometimes 3, and we send the paper to them. The reviewer, of course, then has usually a couple of weeks to read the paper and provide us with their recommendation and their feedback. And I'm going to go into these steps in more detail. The editor then looks at what the reviewers have said and makes that first decision. Very, very rarely the first decision is to accept. Almost always there will be some revisions required, sometimes to resubmit for review and sometimes to reject. Once it's come back again for the reviewers to look at, maybe for a second time, or for the editor to look at minor revisions, then a second decision is made to accept the paper or to reject it. So that is in essence the process. So when I do the screening before peer review, what do I really look at? So, as I've said, the first thing is, of course, is it in the scope of the journal? So we do get submissions from other countries like India or Indonesia or Saudi Arabia or other parts of the world. And unfortunately, if it's not from or about Africa, then at this point, you do get rejected. We also then look at relevance. So is it actually from or about primary healthcare or family medicine? And here, obviously, if the data is collected at a tertiary hospital or in a very specialist environment, and it's clearly not really related strongly to primary healthcare, would also get rejected. Originality, so obviously there must be some scientific value, right, in order to get published. I would say our bar here is relatively low because of our developmental philosophy and trying to enable emerging and early career researchers in the region to publish. So we're not like the BMJ or the Lancet that will only take the material with the highest possible originality. We have a fairly low bar, although I have to say I think the bar for South Africa is going to get a little bit higher to try and balance out submissions from South Africa versus the rest of the continent. It obviously has to be valid and scientific validity, regardless of the level of originality, is always important. And this brings me to the fact that the only thing usually that I look at this point is the abstract. And you'd be amazed at the shocking quality of some of the abstracts. Sometimes the results in the abstract is literally like one sentence, or, there's spelling mistakes and clear methodological problems, even in the abstract. So sometimes I will go and have a look at the full text just to see if it is really worth putting through. But if the abstract is shoddy and doesn't do justice to the work, you may get rejected because you didn't write a very good abstract. So, which does mean, of course, that we should try and do well with our abstracts. Okay, so once I've accepted it, it comes through and it gets assigned to a reviewer, and the reviewer then has to go find peer reviewers, which is often a very difficult task. And we can spend many weeks trying to find 2 or 3 peer reviewers. What you're seeing here is a screenshot of our reviewer database. So the reviewer will often search on keywords looking for reviewers that match the article. And so you can see here on the left are the reviewing interests of these nameless reviewers. It's really, really helpful as a peer reviewer, and I think they'll show you how to do this later, that you have clear and relevant interests that you've put on your profile, so we can match reviewers with what you're actually interested in. Then you'll see the next column actually is a rating. So you may not have realized this, but the editors actually rate the reviewers. So once you've done a review, a rating is given on, I think it's a scale of 1 to 5. And of course, this is now an average of all the ratings. I have to say, if your rating falls below 3, then you probably won't get used again as a peer reviewer. And there are quite a few, as you can see here, who are in the database but have not got a rating and have never done a peer review. The next column is how many you've done. The next column is how long you took to do it. So when we're rating the reviewer, obviously the quality of the review is really what we're interested in, but sometimes how long you took to do it is an issue. Then we can see when you were registered, when you last did something for the journal, and how many other articles you might have active. Obviously, if you're active on an article, we don't normally ask you to look at a second one. So these are the issues that we want to align with your interests. We want to look at people who are reliable as reviewers and who have the expertise that we need. We will often match, though, like a novice reviewer with a more experienced reviewer. It's quite difficult to find. If we only relied on very experienced reviewers, we would struggle. And I suppose it's really where we say, look, what gets published is dependent on the quality of the review. You actually determine really at the end of the day what gets published, because the editors don't have time to read and review every article that is submitted. So we do rely on you. Obviously, if we try to avoid conflicts of interest, so we try not to invite reviewers from the same institution and that kind of thing. And when we're really desperate, then we go to the editorial board members and we beg them to do the review. Often when we're looking for a second review, that's what happens. So why do peer review? Obviously, if you are a peer reviewer, you're probably also a researcher, and you need people to also peer review your work. So there's a reciprocal relationship in the scientific process. Peer reviewing obviously sharpens up your critical appraisal skills and also may improve your research expertise as you look at what other people have done. Keeps you up to date, because if we send you stuff in the field that you're interested in, then you also get updated with some of the latest thinking. Of course, you can put this in your CV that you've peer reviewed, and it contributes to your academic credentials. And you become sort of part of the journal's community and get invited to things like this today. And there may be some benefits to peer reviewing, other benefits, which I think Tracy and Michelle will talk about later. So when you receive an invitation to peer review, what we kind of imagine that you would do is that you would check the title and the abstract in the email and think about, am I interested in this? Do I have the expertise to do this, methodologically and so on? That you would think about any conflict of interest that we might have missed. Sometimes there might also be a bias, that you're, very comfortable with qualitative methods, but not very comfortable with quantitative, or vice versa, and that might be a reason not to accept. Can you meet the deadline? So I think when we send you the deadline, I think we give you 2 weeks to do the review. I would have to say that I would much rather you came back to us and said, look, I can do it, but it's going to take me, 3 weeks or 4 weeks. I'd much rather wait 4 weeks for somebody that I know is going to do it than have to then search for another person and then another person. And each time we wait to see whether they accept. So don't be afraid to email us back and say, look, I can't do it in these 2 weeks, but I could do it in 3 weeks or 4 weeks if we just extend the deadline. So that would be very acceptable to me. I'd rather have, the reviewer in the, the reviewer in the hand is worth two in the bush. And please respond to the invitation if you can. If you're going to decline, it's really helpful if you do decline, and just let us know that you're not available, and then we can immediately look for somebody else, rather than just waiting to see what happens. And if you want to be the really super peer reviewer and very helpful for the editors, if you decline, if you can suggest alternative reviewers or people that you think might be able to do it, that would be really the icing on the cake if you do that. So the expectations of us on the peer reviewer is that, and actually this very first point, very few ever really comment on, which is interesting. In some ways, I should have probably screened out some of these at the initial stage, but some do come through. So if you have concerns about the originality of the work, is there enough new knowledge to really warrant publication, or whether you think, this is really about, some specialist environment and there doesn't seem to be much relevance to primary healthcare, please say, and bring up these issues. And this very rarely happens, but it would be very helpful if you did comment on that. Obviously, you're going to look at the strengths and the weaknesses of the study, especially the methods. When I dig into the manuscript, it's usually the methods section that I dig into. Commenting on issues with the presentation and structure. This requires you, of course, to have looked at the instructions to authors. Often what happens after the peer reviewers have said, accept, I think we should accept this piece, is I then have a look and find all kinds of issues with the structure and the way that it's presented and the way that it's not aligned with the sort of style and instructions to authors in this journal. So it'd be really helpful sometimes if that can be pointed out by the reviewer. Of course, you're going to make comments on how to improve. And this is very much critical appraisal and not copy editing. So, if as a reviewer, we get your review back and it's sort of all like, there's a spelling mistake here and there's a full stop missing there and something that, it's not a very helpful review for us. In fact, once it's accepted, the article does go to professional copy editors. So all of those minor things will be picked up. What we really want from you is the critical appraisal on the science. So here, just to show you, this is where you go. So it's under authors and then under submission guidelines to see what is the structure that we would like. And here I'm going to look at an original research article and very quickly just go through this with you. I'm obviously not going to be able to go through all aspects of critical appraisal, but I'll point out a couple of the common things that we see. So in the introduction, we're looking for one introduction. Often what we see is people have submitted articles that were done originally as like a master's thesis or a doctoral thesis, and then that whole thesis structure comes through, and that needs to be taken out. So we want one short introduction that argues for the social value. Why is this study of any importance or relevance? The scientific value. What do we actually know about this topic already, and what is the knowledge gap that this study is contributing to? Sometimes there may be a conceptual framework. And then at the end of the introduction, as part of the text, not a separate section, the aim and objectives of the study. So as a reviewer, obviously you're looking here to see, is there a good, clear argument? Is there good use of the literature and up-to-date literature in the introduction? Then the method section. This is a section where often we have to restructure it a bit, but these are the typical subsections that we're looking for. Under study design, a brief, obviously, outline of what it is. We do see here often people are not always very accurate in describing the study design. So, for example, they may say this is phenomenology, when in fact, it's not really looking at people's lived experiences. Or may say rather vaguely, this is a qualitative study, without saying what the actual design is. Setting, also interestingly, often is one of the easiest bits to write, but often done very poorly. Even in qualitative work, where we would expect a thick description, often it's like a couple of sentences. So that's something that should be easy to really do, but often missed. The study population and sampling strategy. Again, this is another bit which often very mixed up and difficult to follow, unclear what the assumptions are in the sample size calculation, or people refer often to convenient sampling, which, and often it's not convenient sampling, but fail to really say what they did. I have to say convenient sampling is a bit of a sort of nail in the coffin methodologically, because it really means you just sort of took whoever literally was convenient at that moment. So this is an area where we often focus on to really get this clear. Data collection often done pretty well. Data analysis often also fairly well, although in qualitative work, the steps that are followed are often described in such a tortuous way that you can't really understand what the person did. So getting those steps clearly kind of described is important. So those are just some of the things I think. And now, of course, with qualitative work, everybody now also writes a piece on trustworthiness. When it comes to the results, usually this is one of the better done sections, but some of the key things we often see is people do tables and then in the text say every single thing that is also in the table in great detail to the point at which nobody can really understand what they're saying. In qualitative work, one of the key things that we struggle with is people somehow think that putting in a lot of quotations is actually providing us with their findings, and their actual interpretation of the data is often very minimal. So as we're looking in qualitative work for your interpretation of the data as your actual findings, and the quotations as just supporting that. So it's sort of a reverse of what people often do. And if you're coming from the social sciences, sometimes the results and the discussion are blended together, and then we have to ask you to separate them for this type of health sciences journal. So the discussion, we're looking for these 4 sections. a summary of the key findings, a discussion of the key findings, the methodological strengths and limitations, and then either the implications or the recommendations. I think the things that I would see here frequently is that it's too long. People often have very brief results and then write pages and pages of discussion. I think often this section is sort of overdone. Don't introduce new findings, obviously, in the discussion. And don't discuss things that belong in the introduction, which are not related to your findings, but may well be true. But here you're meant to be discussing your findings. Frequently, there's confusion here between generalizability for quantitative studies and transferability for qualitative studies. And again, in terms of the structure, people putting the recommendations in strange places. This is the structure that we're looking for. And then, of course, at the end, your conclusion. So if you're a reviewer, we've now got a structured form that you fill out, and it looks like this. So there's some sort of multiple choice, which goes through some of the key issues like, is it in the scope of the journal? Is this importance? Is it original? So it's really like social value, scientific value, the aim, is it clear? The methods, how are the methods? And then the conclusion, the timeliness, and your overall evaluation. And then sections here where it's very nice. The confidential remarks to the editor are often very helpful. So this is where you can be very honest, because the author will not see this. This one says, no great concerns on the study, but it is concerning that during the plus or minus 10 hours of interviews, not a single positive remark was reported on. And then here you can summarize the major things that you want to be addressed and the minor things that you want to be addressed. So I think the structured form is quite valuable, and this gets copied and pasted into the email back to the author. Just a word on how are we doing for time? I need to come to the end. Just a word here on the type of feedback from peer reviewers. So these are two comments that I received personally on work that I did from peer reviewers. So first one's like, major shortcomings in the report include a lack of details in the methods, a lack of focus on the study findings, and a lack of rigor in the discussion. And this was another one that I got. The study is important for policy making against diabetes. However, the manuscript lacks merit. It's been poorly written. Number of participants should be more. Most of the sentences are not understandable. So I would have to say that this kind of feedback is not very helpful. So because it's so general, I mean, the author, in this case it was me, but the author really doesn't know what to do with this. So what exactly was poorly written? What exactly lacked merit? What was not understandable? What lacked rigor? And so on. So you have to try and be constructive, and I think, and as specific as possible in your feedback to the authors. Obviously also avoiding any kind of personal comments or criticisms. And then eventually you have to make a recommendation as a peer reviewer. Now, in our journal, in the reviewer form, which I just showed you, you have these 4 options. And then when you submit your review, your overall recommendation is one of these 6 options that comes through to the editor. And there is here, of course, the opportunity for non-alignment. So obviously accept and accept go together. Revisions required should really imply minor revisions. And what happens here is that it will not come back to the reviewers, but the minor revisions will be checked by the editor and then a decision made. Resubmit for review aligns with major revisions. And here, of course, it will come back to you for a further review. Sometimes we are happy if only one of the reviewers at least looks at it in round 2. Obviously, decline submission and resubmit elsewhere basically end up being the same thing, which is reject. And see comments, I have to say, if I could get rid of the see comments option, I would, because what that does, of course, is it makes the editor try and work out what your recommendation actually is. So it's better to commit to an actual recommendation if you can. Do's and don'ts for peer reviewers. So don't be afraid to recommend rejection, even if you're feeling, a little bit sort of guilty about it, or you want to be lenient. But if you really feel rejection, please say it. This is, of course, a red flag to the editor, and if the peer reviewer says reject, we look at that very carefully and often do reject. It's very, very unlikely that we would accept if one of the reviewers says reject. Although, of course, it depends what you've said. If it's nonsense, then we might relook at it. Align, as I've just said, your critique with your recommendation. Don't say minor revisions and then write pages and pages of all the things that must be changed. If you recommend resubmit for review, please be prepared to look at it again. At least one of you, anyway. Can be very helpful to summarize in that form the 4 or 5 key criticisms or suggestions that you think are most significant, so we can kind of see those up front. If you have concerns about the scientific integrity, like plagiarism, then it's probably good to talk to the editor or to the publisher about this and not put it in your report to the author. So sort of come behind the scenes and have a discussion about this if you've got those sort of concerns. And don't, with a few exceptions, recommend that the author cite your own papers. Okay. So the level of agreement, so this is also from Richard Smith. So he says, so the evidence is that reviewers are asked to give an opinion on whether or not a paper should be published. They agree only slightly more than they would be expected to agree by chance. And I have to say, we do actually experience this as editors. It's not uncommon for one reviewer to say accept the paper and one reviewer to say reject it. What do we do in that situation? Well, of course, we look at who the reviewers are and their expertise and the quality of what you've said. The editor might review it themselves as a third reviewer if they've got time, or they might ask for a third opinion, maybe from somebody on the editorial board, or ask one of the other editors to have a look at it and help them with a decision. So that's kind of what happens behind the scenes. Improving the quality of peer review. Training workshops have been suggested, such as we're having today. Standardized report forms like the one I showed you seems to help. Selection, obviously, selecting reviewers. I guess in our database, there are probably more novice and emerging reviewers than expert reviewers, but the selection obviously is a key thing. Feedback to reviewers. So if you do review, I think all the editors do this, that once we've sent the feedback to the authors, we copy you in to the feedback so that you can then see what the other reviewers said about the same article. And if you want to, you can then kind of benchmark what you came up with against what the other reviewers came up with, so that can be helpful. Checklists. We don't require our authors to submit checklists, but this Equator Network website is a fantastic resource for checklists on all kinds of methods. And it can be a really good idea as a reviewer to go here, get the checklist, and use that in your review to see whether the person has done everything they should do. Mentoring. We have offered this, it's probably buried in our announcements, but we have previously offered mentoring to peer reviewers. So if you're a novice peer reviewer and you want to review but be mentored, we can actually link you up with one of the editorial board members, and they can sort of do the review with you, and you can have some discussion and feedback on the peer reviewing. Our review process is double blind, so you shouldn't know who the authors are or where they come from, and our authors don't know who you are. There is a debate in some journals on open reviews, which I'll say something about now, and then rewards. And I think Tracy and Michelle will talk about this. So just on this the last slide, on the open review processes. So some journals have now moved to an open review process where the reviewer is revealed and their review is also published alongside the article. The pros of this seem to be that it encourages accountability and trust in the review process. People can see that there was a review process and what was said, so there's more transparency. The reviewers, of course, get more public credit for their hard work, and their reviews are often more constructive and polite because they're going to be seen publicly. The cons, of course, and this is, I guess, where our journal is currently sitting, is that an open review process introduces all kinds of power dynamics between, very well-established researchers and junior reviewers. And of course, if people know who you are, it may create in a relatively small community some resentment and animosity and cause relational damage. So far, we are still committed to a double-blind review process. Great. So that's what I had to say. Hopefully more or less on time. Neil, back to you and to Innocent. Yeah.
Thanks, Bob. I think that was elaborate enough, and we have been keeping a keen eye on the Q&A, and so far we have no questions.
Oh.
Yeah, but I see there is one hand up, and we have only 5 minutes because I allowed you to go on since we had no questions. Maybe Ilam, you can unmute and ask a question quickly, so we shall only accept 2 questions.
Thank you. Thank you for giving me this opportunity, sir. I am working as an editor of Journal of Akhtar Saeed Medical and Dental College, Lahore, Pakistan, and it was a wonderful webinar which I have attended. One of my concern is that when I am working as an editor and I send my original articles to the reviewers, despite of so many trainings, some of them do not review it as it should be done, and they send a very good report, but when as editor I see the original article, it is not publishable. So how can we motivate the reviewers to meet the timelines and to review the original articles very honestly?
Okay, so look, I think we have the same issue here on the African continent, in the discipline of family medicine and primary care. And I think the quality of the review, of course, reflects the expertise of the pool of reviewers that you are pulling from. And we know that in our continent that, there's very few really established and highly experienced primary care researchers. We've got a much bigger pool of emerging and early career researchers, and of course those are the majority of the reviewers. So that explains why often the reviewers miss things or give poor quality reviews. And so, of course, I think the antidote for this is that we have to improve improve this pipeline from novice to established researcher. We have to raise the capacity of our researchers as a whole in the region, which is, of course, another, maybe not the responsibility only of the journal, but something we can contribute to along with other universities and bodies like Prima Famed to try and gradually increase the pool of more experienced and established researchers who can give high quality reviews. I mean, I think it's a developmental issue. That's how I see it.
Thank you for your response. Thank you.
So I think the other hand went down, but I think there was a yeah. But I think another question, I think, which we will answer the last one, and because I see the others probably will be answered when we go through the website. How do you measure AI use? I think that's one of the questions I saw in the peer review process.
Okay, the issues with AI are going to be tackled by Michelle and Tracy, so I'll leave that to them. Yeah.
Okay, so thank you very much, colleagues. I think in the interest of time, I will now welcome our team from the AOSIS. to tackle the next part of the webinar. So, Michelle, you are welcome.
Thank you very much. Right, so I'm going to take you through some of the peer reviews, and this is what our new peer reviewers will feel like when they receive their first manuscript. Not sure what they can change, what they can't change, what they're allowed to do, what they're not allowed to do. So let me go through the slides and explain. So as you know, you're going to see the word scientific integrity right through all the slides, because that is top prize all the time. And as Prof Mash says, we do double-planted peer review. It ensures impartiality and maintains integrity. Manuscripts are first examined by the editorial staff, which is the AOSIS team. And before we assign it to reviewers, we put the manuscript through Authenticate to ensure originality, integrity, and to detect potential plagiarism, whether it's the authors are unaware that they're plagiarizing. So once we've checked all of that, and if the report score is acceptable, we assign reviewers, or we let the editor-in-chief know all's good, you can assign to expert independent reviewers. So the AOSIS peer review and why it matters. Okay, so that's what we've spoken about, and now the general expectation from reviewers. Our reviewers are expected to consider the following. Are the facts, data, and methods accurate and reliable? Is the work free of errors? But I just want to stop here, and Prof Mash mentioned, when we're talking errors, we're not talking spelling mistakes or grammar. It's if tables are incorrect, inconsistencies or gaps. Is the article thorough, well-researched, and effectively executed? Does it offer new insights or contribute to the improvement of existing practices? So yeah, again, another thing is snaking in besides AI, which we're going to get into, is what we call salami slicing. So we watch that very carefully, because your original research articles must be that original research, and must offer new value and not have the same article published over and over just with tweaking of words. Again, reviewers should offer constructive criticism by pointing out specific and objective weaknesses. So that's what you're allowed to do. What we don't want you to do is rewrite the manuscript. So you're checking for the science, you're checking for accuracy, but you're not going to rewrite the author's manuscript. If you're unhappy with the content and the layout, rather just reject your review and say, this article is just, I can't review it, don't understand it, because we are well aware that our authors are not all English speaking. So that's why, again, we're very lenient with the grammar, but sometimes it's very hard to follow if the grammar is really bad. And there's this thing, the sort of attitude, publish or perish. So that's where the salami slicing comes in, where I've got to publish. So I'm just going to give one article some attention and another article the other attention, but it's really adding no value at all to either article. The AI. So this is a very contentious topic with everybody having an opinion. So AOSIS' stance, and they recently updated the AI policy to address the gap concerning the use of AI tools during the preview process. So we've taken on to say that reviewers are not permitted to submit unpublished manuscript content to AI systems. Please don't. This update is intended to safeguard author copyrights and maintain the confidentiality of the review process. I'm sure this is going to change as the months go on. And what I found was very apt was from a businessman, Gary Vee. You can have any opinion you want on AI, but here's the truth. Technology doesn't care about your opinion. So we'll keep that in mind. So that, I know that one question was, what's our stance? We also look at the authors using AI to put the manuscript together. So what we look at, AOSIS look at, is you're allowed to ask AI to assist you, but you can't just sit back and say, write my manuscript on this topic, because we'll pick it up very, very quickly. And so what we look for is, and we also use tools to check if this manuscript's been written and used by an AI tool, is the human content must be at least 90%, and 10% can come from whatever you're asking GPT chat to help you fix. So if we could see that balance, it's fine. But if it's an outright, and we have seen it often, an outright 99% written by AI, we decline the article. Recognition. So what does AOSIS do for their reviewers? Every year, we publish all the reviewers who have reviewed articles for the PHCF journal. And how it runs is from October to the end of September. So October last year to the end of September this year. Your name will appear on the platform and be published. We do get questions. There's somebody published reviews in October. You'll have to wait for 2026, unfortunately, and you'll fall into that next one. So remember, it's October last year to September this year. There's no monetary reward or anything like that at the moment. We feel it's a contribution to the community. It's a paying it forward kind of stance we take on, and the acknowledgement, the published acknowledgement, is really a nice touch. How to become a peer reviewer. If you're interested in becoming a peer reviewer for PHCFM, it's very easy. You just send an email to the editor and you attach your CV, and in the CV, please have an affiliation email, have an up-to-date ORCID, and brief explanation of your qualifications, areas of expertise, and the key interests. The key interests are very important. That's how we tie you up with the manuscripts. Once approved, an AOSIS coordinator will upload your credentials to the journal, and as soon as an article comes in that aligns with your skill set, you'll be assigned to do a review. Tracy's going to do a live demonstration on how to navigate the journal after a slide or two, and how to update profiles and all of that. So just finish. If you need help, can contact us telephonically. Our office is 825. You can email the journal. It will be answered the next day. Please visit the website. There are a lot of frequently asked questions, and probably that's the kind of question you're asking. They're all listed there, and it's very informative. Or you can have a look at the whole profile of PHCFM, what the guidelines are for the different articles, and familiarize yourself with the journal webpage. We get a lot of questions about CBD points. AOSIS, as a publisher, is not involved in uploading or submitting on an author's behalf. The professionals must log their CBD activities through HPCSA, which I'm sure you all know. Certificates of attendance or completion of reviews are typically required as proof by HPCSA. From AOSIS, when you review, we send you an email which is confirming. It has the title of the manuscript, the dates, when you reviewed, you completed the review, and this email is your proof. It is accepted as proof that you reviewed articles.
Okay, so as Prof. Mash has mentioned, as a reviewer, you'll be registered on the journal, and one of the key interests for you to be a reviewer is your key interest. Every reviewer will be registered on the journal. You would have received login details. If you haven't received your login details, feel free to reach out to us and we will help you get login. If you're an existing author already, you don't get a new profile. It is the same profile. Now, to log into your profile so you can update your key interests, once you've logged in, on the left side of your screen, let me just make it bigger here. On the left side of your screen, you will see, no, it's just gone smaller. There we go. You will see my profile. So if you click on my profile, it will take you to the profile, your profile, and this is where you need to scroll down where it says reviewing interests, and you need to populate that information there, your areas of expertise. And once you've done that, we'd recommend about maybe 5 to 8 key interests that will help Prof. Mash and the editor select the right reviews for the right articles. So once you've updated this information, you click save. Sometimes it won't allow it. If it doesn't allow it, just check what is required to be updated. So after that, I'm just going to share. Are you able to see my email? Okay, so when you're invited as a reviewer, you will receive an email, something like this. Please also just sometimes check. It does happen. It goes into your junk mail. But if you do see something in your junk mail like this, it is an invitation email from the editor. It is a template email with the details, and it will explain everything, and right at the bottom it will give you the abstract. Okay, now with the invitation email, you don't need to log into your profile to access the information. You simply need to click on the link provided in the email. This will take you directly into the article's abstract. It won't automatically allow you to have access to the article. As you can see here, the first thing it's going to ask is, will you do the review or unable to do the review? We ask that you try and respond to this as soon as possible. So like Prof. Mash mentioned, the sooner you let us know, the sooner we can move on and find alternative reviewers. If you are able to, then that will be great. You're going to want to click on will do review. This will then automatically prompt that the article become available. As you can see, submission manuscript under step 3, you click on the file here. This will download the file for you, and there you will have the full manuscript of which you can review. There is a disclaimer, conflict of interest box that you will need to complete. Under step 5, you're going to find the review form that Prof. Mash indicated. I'm just going to click on that there. As you can see, that is the review form. So once you've completed your review form, and you should you have a track change document or additional document that you want to include with the review, you can then upload that by choosing file and then upload it to your submission, to your review as well. Now the review, you've completed the form, you've uploaded your supplementary document. Now you're ready to choose. So I'm going to select from, oh, it's not going to allow me to. It's going to want me to complete something here. Let me just upload something here. I'm just uploading anything there, and I'm going to say upload. Sometimes it does happen that you would upload a document, but you failed to complete the review form, and you realize after the fact, I forgot to do that. If you've completed the review, the system won't allow you to go back in to do it. However, you're welcome to reach out to us and we will help you with that. The same with the additional files. If you failed to include it with your review and you've completed the process, we cannot edit it for you. We cannot change it. You can email us and we will upload it on your behalf as a reviewer. Okay, so now you've uploaded your document, you've completed your review form, and now from the drop-down menu, as Prof. Mash mentioned, please select one of these options and preferably not see comments. This will really help the editors. Once you've selected your recommendation, click submit review. This then completes the review, it is done. However, if it does happen that you click on the link for the review and it takes you to the login page like this, it does happen sometimes. There's very few issues where it does happen. It could be your security settings, but if you are not able to get into the article, you can simply log in to your profile and you will have access to the article. Alternatively, you're welcome to reach out to us and we will help you access the article. We're here to work with you and help you and make the whole process easy. It is not a very complicated process, but we're here to work with you, and we thank you for all your time and effort, because we know it is a huge task over and above your busy work schedules, and we really appreciate you. And then that's that from my side. Thank you.
Yeah, thank you very much, Michelle and Tracy. I don't know, we have one, I don't think we have any questions for you in the Q&A, but maybe
there's one.
There is one. I don't know whether it is specific for them. I think it is for Bob, because I think it is about the difference between major and minor revisions.
Absolutely right. Okay, got you.
Yeah, but I don't know, any questions as far as the navigation of the review process is concerned? Maybe we have about 20 minutes, so I think we have an opportunity to have a few, some kind of interaction. But meanwhile, maybe Bob can answer the question. I think someone is asking the difference between minor and major revisions. I know you had talked about it, but I think it does no harm to clarify again.
So it's obviously a judgment, but the way I see it, so minor revisions, it's normally just a few things that maybe need clarifying, or gaps that need filling. But really the editor can just check whether it's been done or not, or it's just sort of some more like layout or copy editing things. So minor revisions that the editor can easily check if they're done or not, and then make a decision. So I suppose minor revisions is basically saying this article is acceptable to be published, with these few minor changes, and then it's there. Major revisions is saying, look, we're still not sure really about this article. Maybe it could be publishable if these major revisions are made. And this normally means sort of rewriting, in a way, sections of the article, going back and sometimes even reanalyzing data, or changing the argumentation, or being much more detailed about the methods, so, and then it really requires the peer reviewers to have another look and say, are we now happy with this? And usually, actually, what happens then is that it comes back to the editor, and then it goes for minor revisions. So it is a judgment, between the two, but that's just the essential difference. I think the editor's experience as well is, even once the peer reviewers have accepted the article, we still go in and find things that need to be done. So often there's several minor revisions that are needed before we eventually accept it.
Okay, thank you. I hope that is well answered. I see a hand up. Lucky Nora, if you can unmute and maybe ask a question and make a contribution.
Good afternoon. Am I audible?
You are?
Yes, please. You are. Yes.
Yes, I want to ask a question, but as an author. So one time I submitted a manuscript on primary health care, because this journal is a primary health care journal, and I got a response that my manuscript was not in the scope of the journal. So I really did not understand that, because as I've said, that the work I did was from the primary healthcare setting, and I didn't see it as not being in the scope. So could please elaborate on that? Thank you.
Well, as I said in that slide, I mean, we're trying to change a little bit the feedback that we give, so that we can say exactly what, not exactly, but at least in a general way, say this was the issue that made us reject it. So one of the issues, of course, would be, is it in the scope of the journal? But other issues, as I mentioned, could be around the originality of the work or the scientific validity of the work. So there are other issues there that we would consider. And obviously it's impossible for me to remember what the issue was. We don't really encourage appeals, but if you really think we've got it wrong, then obviously you can email and appeal. And if we really think that we did mess up, then we will look at it again. But we don't really retake decisions again once they've been made if they were based on kind of the evidence that we have, and so on. So sometimes, as I say, the abstract doesn't do justice to the work, and there may have been something there that kind of triggered that response. So yeah, it's hard to say, but if it was actually about primary healthcare, it may have been one of these other issues that led to the rejection, or if it wasn't in or about Africa, another reason.
And then just a follow-up question, then there was a little bit of confusion. So after 3 weeks, then I received an email on the same article that they were waiting for me to add something. So I sort of also got confused. So is there no collaboration between the editors? Thank you.
I don't know what that was about. If this was prior to peer review, it may have been Tracy and Michelle and her team looking for some technical piece of information that was missing. But I can't really comment on the specifics.
Okay, I think colleagues, the question should basically be about navigating the platform, because I think the time for the Q&A for the peer review really passed. But I will ask Yasil to ask the last question, and then probably shall have a look at the Q&A box to see what is there. Yasil?
Hello, dear Innocent. I'm so happy to see you here, and Prof Mash, always amazing us, and all of you team. Thank you for giving me this chance. My question, direct, straightforward. How about this processing charge fees? Could we negotiate about this for those who cannot afford? Yeah.
Okay. Well, I'm going to pass that. I mean, I couldn't comment on that, but I think I'll pass that to the publishers, because it's the publisher that does the APCs.
I think the Tracy can attempt the question.
Thank you.
I don't know whether Neil or Michelle, you want to respond to that.
Sorry, Bob. I was answering questions in the Q&A box, so I understood something about APCs.
I think the question is, is there any concessions or relief or options for people that are struggling with the APCs?
Not at the moment. Not at the moment, unfortunately.
We do have a waiver fund, right?
We have a small waiver fund, if I'm not mistaken, but I'm not sure what its current status is. So you would have to write to me about that, Dr. El-Radi.
So that every year we have a waiver fund. It's not enormous, but it does mean that people can write to us and say, can I get some concession off the cost? We obviously can give a partial waiver or a complete waiver, and it would depend. Often I would go look at the authors, and if you're coming from a low-income country, I'd feel quite committed to giving you a waiver. If you come from a middle-income country, I'd feel a little bit committed. If you come from a high-income country, I probably would have not very much, whatever the word is. I think we'd ask you to pay. And if there's a mix of authors, then we might say, well, surely, you've got 2 authors from Australia, surely they've got some money somewhere. or there's somebody from Oxford University or something. And we would ask you to provide us with proof that you don't have a grant and you don't have other sources of funding, but we can provide a waiver to a limited number of people per year. And we do. I think that for this year, in fact, the waiver fund has been largely used up. And I do agree, it is an issue in Africa, particularly for people from low and middle income countries. But unfortunately, of course, the journal is open access, and its financial model is that it's run off the income from the article processing. It's a bit of a constant struggle to see how we can help people, particularly from low-income countries.
So thanks, Bob. I think that is always a common question, and I don't think anyone has a simple answer for it. I think, Michelle O'Neill, we have a question asking whether the peer review can be linked to the reviewer's ORCID profile, so that automatically, so that after they have submitted their review report, then it can be reflected under their ORCID profile, like, of course, what some other journals do. So I don't know whether you can attempt to answer that question, Michelle O'Neill.
I'm happy to take that one. Thank you very much for the question. I also answered it on text in the Q&A box for those who would like to have a look over there. But currently that isn't automated. Hopefully in the future we'll be able to get that right. But reviewers are welcome to manually include the reviews that they have done. So to summarize, not automated yet, but we hope to have that at some point in the future.
I wanted, Innocent, just to sort of comment on the salami slicing, the issue that Michelle raised, because we have come across this a few times where, somebody does one piece of work, like a survey, and then tries to salami slice it, into, 3 or 4 different articles. And then, sometimes they actually submit all those articles to the same journal, to our journal. And then we're like, hang on a minute, or we pick it up that something almost the same has been published elsewhere on the same sample, but now it's just a fraction different, and that's why I think then we have to think about, so shouldn't this have been published as one piece of work, or is this person salami slicing their work in order to get more publications and so on? So that's kind of the issue, and it does come up from time to time. And I mean, Michelle, maybe you also want to say, or Neil want to say a little word about what did you call this thing, paper milling, and these need for peer reviewers and authors and so on, particularly authors, to have an ORC ID and all this kind of thing.
Okay, I'll take the one off, Neil. You
okay.
Can do the paper mill.
Gotcha.
Prof, it's just maybe, I just mentioned salami slicing, but it's possibly could be a nice educational webinar, because the salami slicing has only come hand in hand with AI for some reason. It's coincidental, don't know, but we are getting it more and more and more, and we go to the editor-in-chief for final decision, and we show the editor, there's a published article, and there's a published article, and in that journal could be an external journal, or 4 articles in the same journal. And that's where I think it's coming from pressure to publish. That saying, perish or publish. We give the authors the benefit of the doubt, and we approach them, and we chat to them, and we point it out, because it is actually unethical what you're doing, because you're not doing it for the good of the research. So we are strict. It started off just an odd one here or there. It's a lot more common, so we look out for it now. Over to you for paper milling, Neil.
Just to add on to that, I mean, when we do have an issue like this, I might sometimes ask the same peer reviewer to look at 2 articles, from the same author, and say, shouldn't these really be one article? Why are we now, slicing this into 2? Sometimes that's a question we would ask the peer reviewers. Yeah, Neil.
Thanks. My mic is on, yes. Thanks very much. Yes, colleagues, I'll just briefly make a note about what paper mills are. Some of you may not have heard of what they are. They are basically organizations that prepare fake manuscripts and sell them, and they infiltrate journals, usually well-indexed journals on, for example, Scopus and or the Web of Science. And then they ensure that authors who pay a fee to them get their manuscripts published. And they have all sorts of ways of doing so. They can bribe people involved in the journal, or they can manipulate the peer review process. So this activity is unfortunately on the rise. And in some ways it's also linked to AI, but it's not just because of AI. And so we need to be sure that we are working with real people. And that's why we have the need to ask for institutional IDs, email addresses and ORCIDs that are populated, so that we can basically ensure that we are dealing with real people. And when there isn't an institutional email address available, we ask the author to provide us with a valid reason, because we do understand, for example, that some emerging writers or reviewers may just have graduated and may not yet be affiliated with any institution, but then usually that is easy enough to explain. It's when we ask the questions and no answers come that we become suspicious. I hope that was a sufficient and brief explanation.
And I think as a peer reviewer, if you have suspicions of that nature, you should raise it with the editor, and then we can look at it. If you think this is a fake article or written by some artificial intelligence and it's slipped through the net, then feel free to not raise your question with the authors, but raise your question with the editor behind the scenes. Yeah.
Perfectly agree. Yeah.
Thanks, Bob and Neil. I don't see any other hand up or any question in the Q&A. I think most of the queries have been clarified. We have about 7 minutes, and I think if we don't have any further questions, we will stop here. But I think before, first of all, I want to thank you once again, Bob and the team from AOSIS, for spending time to take our dear reviewers through this kind of capacity building workshop. And it is really because of peer review that keeps science alive. And I want to really make a humble appeal to everyone that please, when we call upon you to review the submissions, please respond positively. It is one of the most difficult tasks of editors, and it causes a lot of anxiety. So, but this participation shows that we shall get better, because I think as the time goes on and we develop capacity within the region, peer review is becoming a little more easier, and I think of better quality. So thank you once again. And I think it is important that all of you look out for the next e-workshop, which I think will be in September, but Bob, I can't remember the dates.
Okay, so strictly speaking, this isn't part of the Prima Famid e-workshops, but the next e-workshop will be in October, because we're having the Wonka World Conference in September and other things, and it's a very busy month. Yeah.
Thank you very much. We are the same community, and members, thank you very much for coming, and we are really looking forward to working with you as we keep on improving the scholarship within Africa and beyond. Thank you, and enjoy the rest of the day. Bye-bye.
Thank you very much.
Thank you, everyone.
Thanks, everyone.
Thank you.